Hello and welcome to another episode of Cardiometabolic Beat, brought to you by the Cardiometabolic Health Congress. Today we have the pleasure of speaking with Dr. Carl Lavie, Professor of Medicine and Medical Director of Cardiac Rehabilitation and Prevention, as well as Director of Stress Testing Laboratory at John Ochsner Heart and Vascular Institute in New Orleans, Louisiana. Dr. Lavie is a nationally and internationally recognized expert in obesity and preventive cardiology. And at the upcoming 2021 CMHC Spring, he will be part of a special panel to discuss the impacts of COVID-19 in obesity management, which will also be the topic of today's discussion. Dr. Lavie, thank you so much for being with us today.
It's a pleasure, Lindsay.
Let's jump right in. Dr. Lavie, after more than a year into this pandemic, what do we now know about the relationship between obesity and COVID-19, both in the risk of SARS-CoV-2 infection and COVID-19 severity?
Yeah, so we actually learned that obesity was a pretty bad risk factor pretty early in COVID. There's many reasons for this, and one is that obviously obesity impacts a lot of the cardiometabolic risk factors, and certainly hypertension, the renin-angiotensin system, and diabetes are big risk factors for having COVID and having worse complications and higher mortality in COVID. Second is that obesity increases most of the cardiovascular diseases, especially it increases atrial fibrillation with preserved ejection fraction and heart failure. These are big risk factors as well for mortality in COVID. But obesity also worsens coagulation, and as obese already have a coagulopathy. One of the big reasons why COVID causes complications is the inflammatory response to COVID. And so a hyperinflamed response is a bad thing in COVID. And obese already have an increased inflammatory state. They already have increased levels of the interleukins and C-reactive proteins and leptin. Obese also have more respiratory disease. They have decreased restriction, more restrictive lung disease. And so they already can't handle the respiratory complications of COVID. We found out early in COVID, people were really worried about running out of ventilators. Many hospitals around the world came closer to running out of dialysis machines. And there's a lot of renal failure in COVID, and obese already have altered renal function. So they already have abnormal renal function to begin with. So they have less renal reserve to take care of COVID. So there are many reasons, and there are others as well, why obesity worsens the complications in COVID. And we did a meta-analysis fairly early in the COVID, where we analyzed 13 studies as published in Mayo Clinic Proceedings, where we showed that there was a 39% higher severe complications, things like ICU admissions, mechanical ventilation, and death in the obese compared to the non-obese with COVID. So there's no question that the obese are a high-risk group of patients with COVID. Now, they may actually get the disease more to begin with as well, but probably it's more that their complications are higher. The one other thing that I didn't mention is that the COVID virus attaches to the ACE2 receptors, and the adipocytes, the fat cells, are loaded with ACE2 receptors. There's actually more ACE2 receptors in the fat cells than there is in the lungs. And so the obese really have a ton of COVID in their body. The fat cells serve as a reservoir for the COVID. So it's really a bad situation when the obese or people with a high amount of body fat get the COVID infection.
Thank you. Dr. Lavie, do you think that COVID-19 will make the obesity epidemic worse, or has it already done so?
Yeah, so I think that, pretty much we're seeing, and there's already some early reports of this, but I think that in our clinician offices, we're seeing so many people come in and have gained 10 pounds, since the beginning of COVID. And so, I mean, I think clinicians are used to this anyway. They typically see people come into the office and they've gained a few pounds since the last visit. This seems to be amplified in COVID. I think that so many people, and there's actually jokes on the internet and in the newspapers about the weight gain in COVID. And this was actually seen. There were jokes about this in April and May of last year, or very early in COVID. But I think it's pretty much a universal experience that people have gained weight in COVID. And some people have gained 30 pounds, but a whole lot of people have gained 5 and 10 pounds during COVID. And so when you're dealing with the United States that already has 42% of the adult populations with BMIs over 30, and already has 9% of the population with BMIs over 40, even prior to COVID, this is a really bad sign. But then you add one other factor, is that not only are people gaining weight, many people have stopped exercising. Now, there's a few people that have exercised more during COVID because they have more time and they've been, maybe they've been working from home. But I think the majority of people have exercised less. And so many people depend on the gyms to go exercise. And many of the gyms were closed early in COVID. And then there's many people, especially many older people, have been afraid to go to the gyms because of the concern of catching COVID, even when they've been back open. And so many people have actually said their exercise is way down. And not only does exercise play an important role in preventing weight gain, but exercise is also a very important and the main component of having higher levels of cardiorespiratory fitness. And there was a paper in the Mayo Clinic Proceedings from Bowman Gray that actually suggested that fitness really protected against hospitalizations from COVID. And they actually showed, it was a pretty small study though, only 250 people, but they actually showed that fitness was more important than weight for predicting hospitalizations from COVID. Obese had more hospitalizations, but when you corrected for fitness was a much more important factor. Now, we don't know for sure, does fitness also protect against the severe complications like ICU, mechanical ventilation, and deaths? My prediction is we're going to find that fitness is also a very, very important predictor of the prognosis in COVID. So if you have this pandemic, increasing weight and lowering exercise and therefore lowering fitness, that's a really double whammy. And that's kind of an example of when two pandemics collide, the obesity and the sedentary behavior, they both colliding in the middle of another pandemic. So we really maybe having a bad tsunami effect of the COVID epidemic. And even after we get through COVID, we're still going to be left with the higher obesity and the lower fitness.
When talking about overweight and obesity, what spectrum of obesity is associated with worse COVID-19? For example, are we talking about patients with severe obesity or a broader range?
Yeah, so I think that, the question is, I don't think we have all the data on, for example, is overweight. 75% of the United States population are either overweight or obese. Does overweight increase the risk of COVID? My impression is that's not the case. Most of the papers have really actually just used the BMI cut point of 30 and shown that obesity is a higher risk. But I do think that there are a few papers that suggest that severe obesity is particularly a higher risk. And I think this is many clinicians' impressions that they early on in COVID in March and April of last year, when they saw all the patients who were on the ventilators with COVID, many of the people on the ventilators had the BMIs in the high 30s, in the 40s, in the 50s. And so I think many clinicians' impressions is that even though obesity itself may be a risk for severe COVID, that particularly the patients who are having more severe obesity are especially at risk. And this is the same thing we would see with something like atrial fibrillation and heart failure. Certainly, obesity itself is a risk factor, but the more and more you gain weight and the more you're obese, then it becomes a particular risk factor for these diseases. And I suspect that COVID is no exception to this.
Given the impacts of COVID-19 in individuals with obesity, do you think obese individuals should also be added to the COVID-19 vaccine priority list?
I think that'd be no no question that this would be the case, and that's actually already been done in our community. In the the first group that the priority was the over 70-year-olds, and then it was the 65s. But then when they added comorbid conditions like cardiovascular disease, hypertension, et cetera, obesity was also listed. I'm not sure if that's been done all over the United States and the world, but certainly I think that obesity is enough of a risk factor that this should be a major factor. Now, of course, obesity is also increasing cardiovascular disease prevalence, it's increasing diabetes prevalence, it's increasing hypertension prevalence. So these all groups are getting priority. And one could say, what about if the obese doesn't have cardiovascular disease, doesn't have hypertension, doesn't have diabetes? How much are they still at risk? And that hasn't all been factored out. But I think that obesity is itself enough of a risk factor that by itself, it should also be a high priority for COVID. And we've been saying this fairly early in COVID. I have a YouTube video for one of our papers that came out I think it's around April in the Mayo Clinic Proceedings, a review on obesity and COVID. That in the YouTube video, we talk about that the patients with obesity really need to be assessed more vigorously, managed more vigorously in COVID. And now that we have the vaccines, that should also be part of the equation.
Thank you. And final question, what are some strategies to combat obesity in the time of COVID-19?
And certainly, I think that people, now we're pretty much far into the pandemic, and hopefully we may even be coming toward the end of the pandemic. But I think that a mistake was made early in telling people when the people had to quarantine. Quarantine did not mean not going out and walking. And being housebound, was I think that was sometimes people's impression, and I think there was a lot of scare early in COVID that you could walk out of your house and catch COVID from the air, and I think we now know that that's certainly not the case. And so, for one, people can be doing exercise inside. There's a lot of opportunities to do exercise by, walking in place, jogging in place, walking around your house, doing videos, on the internet, but certainly going outside. It'd be one thing, going to the gym that's crowded, and at least that, people thought you could be catching COVID from the equipment too. And that's probably not the case. But I mean, I think there was a lot of a misconception about that early in COVID. We know that that's all not the case now, but certainly it was a mistake telling people that they couldn't leave their house. It's one thing going into large gatherings. It's one thing going into close quarters, but going out, walking in your neighborhood by yourself or with your significant other, your spouse, that is safe, and it's safe now. And people need to at least be doing that, burning some calories. And then obviously for everything, this is always easier said than done, but if people are going to be nervous eating because of the stress, it would be one thing eating carrots and eating popcorn without the oil than eating up the junk food. And I think that certainly if people could make better choices with the diet, that's a lot of times easier said than done. And that's why I really promote the physical activity component of this, is that I do think that physical activity, exercise, and fitness is so important. One, for preventing weight gain, and for at least preventing the higher weights from going on to more severe obesity. But because of fitness is so important, this becomes a tremendous impact. And that all of this also helps relieve depression and anxiety as well. And so that really, I think, is probably the strongest thing that can be promoted, is that even in a pandemic like this, people could try to maintain or maybe even increase their physical activity to make up for the other components. And I think that is probably the message that that people need to be doing now. They need to be doing this before, and this is something that we'll need to be doing for the next pandemic, as well. Hopefully we won't have another one soon, but these kind of things will happen again. And hopefully we learn from this one and we can be better the next time.
Well, thank you so much, Dr. Lavie, for your time and expertise.
Well, thanks. It was a pleasure being with you today, Lindsay, and I look forward to the conference.
Thank you. And thank you to all of our listeners. We hope you will join us and Dr. Lavie at the upcoming CMHC Spring, which now has a complimentary registration. For details on how to register, please visit cardiometabolichealth.org. And lastly, if you have any questions or you have any feedback on topics you would like to discuss in future episodes, we would love to hear from you. You can email us at info@cardiometabolichealth.org. Thank you, and until next time.
Should be a fantastic meeting. Thanks, Lindsay.
Thank you.